Hey Warriors! Welcome to season 2 of the Invisible Diaries. We're your hosts. I'm Misty.
And I'm Amber, and today we're coming to you from our new office space. We have a really great episode for you on a topic that is near and dear to our hearts. But first, we have a quick disclaimer. Any information discussed in this podcast is strictly our opinion and for informational purposes only. It is not meant as medical advice and should not be taken that way. Always consult with your doctor or medical team first.
Any cited resources mentioned today will be linked to the episode on our website at theinvisibleidiaries.com. I can't believe we've made it to season 2, and today we're doing episode 1, which is crazy.
We know it's a little echoey in here. We've got some stuff coming for that, so it won't feel quite as bouncy, reverbery in here.
Yeah. This is our new office space. Right now we have some plastic chairs and we've made a little makeshift area, but as everyone is patient with us over time, we're gonna have some new chairs and maybe this will look a little nicer.
We'll do a full office
sound,
yeah.
all that good stuff. So this is literally, actually tomorrow is when our lease starts, so we are moved in a little early and we will see where this goes. Of course, if anyone wants to go to our website, we do have a little donate tab.
You can buy us a tea or a coffee.
Anything helps for us to make a really awesome production.
Yeah, we'll just keep, you know, as we learn, we're sharing, and we're, like we said in our announcement video, we have a lot of amazing content planned for you guys this year, so we just, you know, right now it's a labor of love, so.
Absolutely, and as you're listening to this, our magazine has launched, so that's super exciting. If you didn't know about that, you can go to our website. There's going to be a blog post about it with all the links, and then we'll be basically we're going to have a lot of awesome new content from other contributors, and so if you want to be a contributor too,
send us an email at theinvisibleidiaries@gmail.com.
Yes, and then in the subject just put collaboration.
If there's a particular section that you find that you're drawn to or you're passionate about, you have something you want to say, just let us know in the email.
Yeah, and don't be scared, because I know it can be intimidating and sometimes we worry about our grammar or the style of writing or typos or whatever, but that's what we do. We are going to help you out with that. We can send you a template to ask you the questions. We can edit what you write so that way everything comes out you looking good.
You know, we want to hear from each other, because who else knows what we're going through other than other warriors?
Somebody could read your story or hear about your story and perhaps they felt alone, or maybe they can learn something about it or get some advice or tips, or just feel like they're not the only person in the world. So, I mean, it may seem like a small little thing, but it really is not. It helps in so many ways.
The elephant in the room right now is COVID-19. Obviously we're in Florida, so we have a feeling things are going to be shutting back down for us after this holiday weekend coming up. Our numbers here are headed in the wrong direction. So there might be a little bit of change in the way that we're having to record, just because we're wanting to respect each other.
We've been doing the social distancing thing, we've been quarantined, and so we're not really sure our next couple episodes we might have to do distantly. We were debating on even doing this one distantly or with masks. I don't know. We're kind of just going with the flow.
You guys know we have to be even more careful than what guidelines are expected.
This is season 2, episode 1.
Yes.
And we decided to discuss Ehlers-Danlos syndrome. We know a lot of people who tune in have Ehlers-Danlos syndrome, and I have Ehlers-Danlos syndrome. Amber's got that on her list. She doesn't know she might have it as a possibility, so she may be circling it or crossing it out as time goes on, and so we're basically going to discuss how you figure that out, how you get diagnosed, the process. I have a Q&A that we pulled.
Well, and obviously COVID changed our plans a little bit. We thought we would start this season with something that was the driving force for our own advocacy, especially for Misty.
We are discussing Ehlers-Danlos syndrome because I have Ehlers-Danlos syndrome, which I didn't get my official diagnosis until just in the last couple of years. Amber is also looking into it as a possible diagnosis, and I understand that this is rarely diagnosed, more so than it is rare. So of course, you know, we want to share information and shed light on invisible illnesses, advocacy, and raise awareness on these type of issues because it takes so long to get diagnosed. And then another statistic is that 1 in 20 are misdiagnosed, which is approximately 12 million per year.
And we've talked about it a lot, and you guys know that basically with a lot of these chronic illnesses and autoimmune diseases, they start to overlap a lot of their symptomology. And one of the reasons that we wanted to start with Ehlers-Danlos syndrome is because with this being misdiagnosed as often as it is and missed as often as it is, there are things symptomology-wise that you may have lived with your whole life that you don't think anything of. It's just part of your normal. And there are a lot of misconceptions, which we'll get to, but we just kind of wanted to start the icebreaker of this season, you know, with what is EDS and, you know, what really does it mean to be a medical zebra?
Exactly. Collagen is the main component of connective tissue, making up 25 to 35% of the whole body protein content, which is a lot. Think about it, a lot. That includes tissue, bone, cartilage, blood, and lymph, which are examples of connective tissue. So connective tissue offers support, protection, storage, transport, and connection throughout the body. It's kind of like the glue that holds us together.
It is like the glue.
That being said, if you think about it, wouldn't you think that it would be a systemic disorder that would affect multiple areas of the body, if not almost every part of the body, right?
Which is what happens commonly. It's what I'm going through currently now, and Misty's been a really great help at helping me navigate where to start because it affects so many symptoms. I mean, gum and teeth and heart, cardiovascular, I mean,
digestive.
Yeah. So I mean, there's so many skin. I mean, there's so many things that, you know, realize just how much connective tissue you're made of.
Yeah.
Because those things are made of connective tissue, you know, a lot of things are affected at once or sporadically, and you don't always know when you're speaking to a specialist to mention all of those things.
Right, and usually if you are with a specialist, you're only mentioning the one thing that they specialize in. So if you're just only seeing a cardiologist for one issue, then that might just be the focus versus trying to figure out the puzzle of all of it put together that basically...
And if you think about it like a camera, when you're zoomed in on something, you know, you're getting a lot of detail, and that's what a specialist provides. They're providing an immense amount of detail on a very specific thing. But if you back out of that and you look at the whole picture, you realize how much, you know, more is there. And that's kind of, with EDS especially, you know, starting with the geneticist, which we'll get into, is helping kind of take a step back, because if you're too focused, sometimes you're not really understanding why. You know.
Yeah, and then the other issue is you might just get that one diagnosis on this one specific thing you're seeing, and then you're like, okay, that's what it was, but really, you know, sometimes it's the umbrella, which is Ehlers-Danlos syndrome or something else. It could be Lyme disease or autoimmune, and then everything underneath that is caused by that. So it's really important to find the root of what is causing these issues. So for me growing up, I actually was looking through my chart recently when I was about 18 or so years old, and the cardiologist said, in the chart, they said, this patient just has a lot of unique and interesting symptoms, like several. And so what frustrates me is that nobody thought, like, why would this young woman, 19, 18 at the time, have all of these issues? Instead, they just kind of focused on the one thing and let me go out the door. So a lot of us in this community fall through the cracks.
Or we become case studies, because that's the issue that I run into, where it's like, wow, you're so young and this is such an unusual thing. Could I do a case study on you? And then you never want to be the case study.
Yeah, so we can go into our Q&A. We had a couple of questions, and I made some notes. So I'm going to try my best to like not read them too much, but just to kind of keep myself on track.
Yeah, and I'm going to ask the questions just because Missy has already gotten her confirmation with EDS. She's really familiar with this topic, not only as someone that lives with EDS every day, but also as a huge advocate for EDS. And if, again, you're going to hear us refer to Ehlers-Danlos syndrome as EDS, just because it's a lot and a mouthful to say. If you hear us saying EDS, that's what we're referring to. So Misty, what's the most misunderstood thing about having EDS?
Ehlers-Danlos syndrome is very misunderstood, with autonomic dysfunction, severe chronic joint pain, digestive issues, and many other symptoms. It can be very debilitating. It's misunderstood because many people, and even healthcare providers, just assume it's about hypermobility, with the exception of vascular Ehlers-Danlos syndrome, which we'll say VEDS. That is the more serious, dangerous one. And so most of the time too, if you don't have that one, then they don't take the other subtypes seriously. There's 13 total.
Right.
So I mean, I've gone into doctors and they're like, oh, you don't have that one, so you're fine. I'm not concerned, but they don't realize that it affects the whole body. And that it's just, in their head, they just think, you're just flexible, right? You know, but it's like, okay, yeah, I can pop these out and move, you know, but think about my organs and the, you know, the tissue between my spinal column and my digestive system.
Honestly, flexibility is the least of, I mean, yes, a lot of people are with HEDS, which is a hypermobility subtype, are flexible, but not everyone, you know, which is why there's the scales.
Right, yeah, the Bateman scale was designed to, it's like a 1 in 9 or 9 different things that you do. One is with your thumb and with your legs, that kind of thing. So that's just one little aspect. The reason why we're called the zebras in the medical field is because healthcare providers are trained that if you hear hooves to think horses and not zebras. So being the zebras, again, when a healthcare provider typically would see someone like us, they think, no, it can't be the rare thing, it's not likely this. What would it most likely be? You know, and they think horse, and they just, oh, it's probably just this simple thing, take this and send you out the door.
So I have read that there are many different types of EDS. Can you have more than one type at a time?
So there are 13 subtypes, and a great source that is linked on our website and will be linked in the blog with this episode is the Ehlers-Danlos Society. And according to them, they say that it's extraordinarily rare. So in one way that it could possibly happen is if you had two parents who had two different types of Ehlers-Danlos syndrome and it just so happened to get both of those, but that's not always likely. Maybe, but I wouldn't say absolutely not. Just not likely.
So what are the first signs pointing towards EDS, and how can a person focus in on those to speak to their doctors and try to get a diagnosis?
That's a really good question. In my opinion, the signs were always there in the beginning of my life, which this can vary for each patient. I've heard of some Ehlers-Danlos patients getting into a car accident or having some type of trauma, and this kind of highlighting the issues. So you can have some people that have the hypermobility syndrome, which is benign. You can have some that, you know, have more severe aspects of hypermobility EDS or any of the other Ehlers-Danlos syndromes where they can be very obvious, very severe. They're in the hospital all the time. You know, many people have feeding tubes. And then you have some people who might not have those issues. So it's gonna really vary. We're all unique snowflakes.
More research is coming through. There is a hypermobility spectrum, and we know with spectrum that means, you know, it's wide.
Right.
So it doesn't always, just because you have some of these doesn't always necessarily mean you have EDS, which is why it's really important to see a geneticist.
Absolutely. So I have always had health issues from cardiac, digestive, chronic pain, and of course hypermobility.
Right.
I never thought like what you call double jointed, it's not actually double jointed, but I never thought that that was like a sign. So to me that was just normal. That's just what I did. Having the heart issues, that was always looked after, but nobody ever linked all of it together. So instead of getting answers, they just documented it in my medical records. So that's kind of why I got really involved in being my own advocate. I started questioning them. I started saying, like, is this normal? Like, my friends don't have all these issues. Like, why am I at this age having these heart issues? So it got to a point where after doing the research and trying to finally getting pointed towards a couple different diagnoses where I was able to cross them out. And then, you know, even with Ehlers-Danlos syndrome, when I first heard about it, they showed the picture of the boy who's like super double jointed. Well, I am. Like, I can totally go like do this crazy stuff. And I still looked at that picture and I was like thinking like, I'm not that extreme. And so I dismissed it, totally dismissed it, which I thought was interesting. I guess because we think if we have to fit that, it has to be the extreme, but it doesn't. And so eventually when I circled back towards it, and I realized like, well, actually I am really hypermobile. I do have all these issues. Being an advocate for myself really helped me to narrow it down, the possibility. But in order to get the diagnosis, you've got to see a geneticist. We do have one that we recommend on our website. He's actually featured in the magazine this month. It's Dr. Atwal. He's a geneticist in Jacksonville. He does do video. He was originally from Mayo Clinic. He started his own practice. He was great. So basically, you know, you want to rule out the other types. And fortunately, he does specialize in Ehlers-Danlos syndrome, because originally I saw a different geneticist and she wasn't familiar, and she was like, you need to see somebody who understands it more. So it's definitely a journey, but genetic testing is really going to help you to get the answers you need and possibly even find something maybe that you weren't expecting.
So Misty, what are the alternative treatments you have used over the years, and how much have they really helped?
So because I have so many different health issues, I would probably be on 15 to 20 different medications if I took everything that was prescribed to me. I do take 3 different types of heart medications. They're all low doses. And I want to also say that if you do take all those meds, there's no shame in that.
We do not
do whatever works for you. Yeah. So for me personally, I like CBD oil, and if some of you may or may not know, I do have my own apothecary CBD shop, Wilding Apothecary. Check it out. That really helped me, and I do occasionally will take a low dose of THC. I do prefer more of the CBD. I also take banana bag oral solution, which is also in our magazine this month, that you can check out. That helps with dysautonomia and POTS. It helps so that I don't have to go and get as many IVs, because that is another treatment, is the IV fluids.
The saline infusion,
Yeah, and I take vitamins every day. When I was younger, I had chronic anemia, so I don't take iron on a daily basis, but I take it as needed when I feel like I'm starting to get like lethargic and bruises. I take vitamin D for my immune system, as well as vitamin C. I take a bioactive methylated folate and B12 because I do have the MTHFR mutation, but I feel like vitamin deficiencies are fairly common, especially not just with EDS, but autoimmune and just a lot of people in general. So last but certainly not least, I do have a strict diet. I try to avoid high histamine food because of the mast cell reactions. I can get tachycardia, migraines, visual disturbances, low blood pressure, disorientation, and so I guess my main suggestion really is just to take the best care of yourself as you possibly can, because we already have enough things wrong going for us. So if I can make sure to get sleep when I need sleep, stay hydrated, make sure that my body is nourished and I'm putting healthy things in my body, then I'm giving myself the best opportunity to feel the best I can.
Absolutely. Like you, I have significant cardiac issues. What would you say to encourage younger individuals with these issues?
I guess my advice would be to use your frustrations and turn them into productivity. Keeping my mind busy and occupied. Understand also the stages of grief, which is denial, anger, depression, bargaining, and acceptance. Understand that most days are not going to be good, and that's okay, and just try to not live in those dark places. Do as much as you can to give your body a fighting chance. Like I said before, nourish your body, self-care, rest, hydrate, healthy food, movement both physically and mentally, and then challenge yourself. You know, it's really important to, I think it was Dr. Raj who spoke for the Dysautonomia International Convention, and he had a really good point just about self-care and keeping your mind right. It's such a huge part of treatment with this, because otherwise life can be kind of bleak, and you really have to find a way to mentally try to stay positive when you can.
It's one of the reasons that we use a lot of humor on our Instagram channel, because it's not funny by any stretch of the means when you feel terrible all of the time. But if you don't put a little bit of humor on it, I mean, it just is overwhelming, and that's not a fun place to be, because nobody's by themselves. You know, we say a lot of it, this is an individual journey, but you're not by yourself. You can even reach out to us. You know, you can contact us on our website. You can reach out to us on our DMs with Instagram. You know, we
do have a section on our blog for links and resources. So if there's one that you don't see that's on there and you think we should add it, just let us know. Otherwise, we do have different resources for POTS and Ehlers-Danlos syndrome, and we're going to continue to add to that as we're like relaunching our website and new physicians and different resources.
Absolutely.
So I wanted to say a quote, which is, "No other disease in the history of modern medicine has been neglected in such a way as Ehlers-Danlos syndrome." And that's by Professor Rodney Graham. And I love that quote, and that just is something to remind myself why we do what we do, so we can raise awareness and
shed light on things that are in the dark.
Absolutely. So, you know, before, I've had moments in my life where I was in that dark place and I just felt hopeless, disheartened. I felt like there was nothing I could do. And so again, I used my frustrations, turned that into fuel to be productive about it. And, you know, what can I do? Maybe I can at least help others to have a fighting chance, or, you know, spread awareness so that way the future doesn't have to go through what I had to go through and wait until I'm in my 30s for a diagnosis.
Absolutely. And if you're someone like me that's still in kind of that limbo, hang in there. We're going to be doing an episode on naming your monster and why that's so important, you know, why we keep persevering to try to name it. In order to be able to deal with it, sometimes you just need to be able to name it.
Yeah.
Not only to know what you're dealing with, but also it feels like you're like, okay, it's not this thing that I don't know anymore hiding under the bed.
Right, because, and now that you mention that, it reminds me, I had a doctor who said to me once, before I saw the geneticist, I was like, I'm suspicious of Ehlers-Danlos syndrome, and here's why. And I said all the reasons, and he was like, well, it doesn't matter, you don't need a diet, the diagnosis isn't important because there's nothing you can do about it. And I'm like, well, that's irrelevant, number one. It's the validation. Like, we need the validation, because when we're told it's in our head, or
it's just a panic attack or anxiety,
it's not okay. And sometimes we really just need to have that validation. You know, yeah, I have days that are hard where I remember that this isn't anything that can be cured, and I get depressed and I go into a dark place, but, you know, at least I know what it is now, and that's made a huge difference. And the parts that, because I have a name to this, I am able to manage and, you know, learn ways that may help others, and figure out ways that helps me, so that I can try to treat this, at least to make it more manageable.
Absolutely. And if you're in that place that you don't know, like me, where you have some things that are definitive and some things that are not, hang in there. This is why we're doing what we're doing. This is why we're so passionate about this, because it is important to name it. And even if you can't name it now, just know that we are right there with you.
Yeah, we're a community, and that's why, you know, that's why we got an office space, and that's why we're trying to launch this magazine. We want to get the word out, not just for Ehlers-Danlos syndrome or autoimmune, but just for everyone who has a chronic illness of some sort that wants to be heard. It's time for us to, you know, be respected and to be listened to. That's why we're here.
Yeah, absolutely. We just want to say thank you guys so much for bearing with us. COVID's still throwing a weird curveball in our plans, so it's a little bit weird. Not quite the launch we were hoping for, but if you don't see us together moving forward for the next few episodes, we still are going to be pumping out plenty of content. It's just going to be a little different than what, you know, our
and so make sure to go to theinvisibleddiaries.com and please subscribe, because if you subscribe, you will get an email every time we have a new episode come out. You will get an email when we release new content. Like, we have so many features that are going to be pumped out here over the next month that were in the magazine, like the interview with the geneticist, which he has a lot of great stuff like what to ask.
Yeah.
We have Amber did a product review. We have a lot of really cool stuff. So if you don't want to miss out, make sure you subscribe. Check out, you know, our physicians spotlight feature, our resource feature.
And reach out to us through the contact us page.
Yes.
We love your comments. We read through them. We take the time because your voice matters to us.
It does. And also, you know, understand that we would never intentionally ignore anybody. It's just we both have chronic illness and we try our best to, like, it's just us. This is us. This is what you see is what you get, and we're doing our best. And so we are so appreciative that you are all understanding of that.
Thank you guys so much for tuning in. Stay tuned for episode 2. And if you could, leave us a review on whatever you're listening to this on. It just helps other people find our information. So
yes, we want people to find us. And
until then, you guys, please stay safe. Listen to your local officials and protect yourself.
Do what's best for yourself and be considerate of others.
Love you guys. Take care.
Bye.